Most people fast for hours every day, yet stubborn belly fat stays right where it is. Even worse, the most dangerous fat hides deep inside the body, far from sight, quietly damaging organs and slowing metabolism. This video exposes why effort alone fails and why time plays a far bigger role than discipline. The truth about fasting and visceral fat has been misunderstood for years, and many popular rules miss a critical detail that changes everything. In this video, you will learn exactly how fasting affects fat at different stages inside the body. You will discover when the body switches from burning sugar to burning stored fat. You will also learn why visceral fat responds differently compared to surface fat, and why certain fasting windows trigger powerful hormonal changes while others deliver very little impact. These details rarely get explained clearly, yet they determine real results. Many people believe longer fasting always leads to better fat loss. Science tells a more complex story. At specific hours, insulin drops, growth hormone rises, and fat cells become vulnerable. Outside those windows, progress slows or even stalls. This video breaks down those hours in a simple way using real physiology instead of trends or hype. You will understand which fasting duration activates visceral fat burning and which ones only drain energy. There is also a hidden reason why some people see results quickly while others struggle despite following the same routine. Sleep quality, stress hormones, and post-fast eating patterns quietly decide success or failure. These factors receive little attention, yet they shape the outcome more than willpower. By the end of this video, you will understand how to align fasting with these internal signals to unlock steady progress. This video also clears confusion around popular fasting styles. 16 hours, 18 hours, 24 hours. Each has a different effect on the body. You will learn which range delivers the best balance between fat loss, sustainability, and health for most people. You will also learn why pushing harder can sometimes slow results instead of accelerating them. Stay until the end, because the final section reveals the single mistake that blocks visceral fat loss, even in people who fast consistently. Fixing this one issue often leads to visible changes within weeks. This knowledge saves time, protects health, and prevents frustration.
Welcome to our channel where science meets clarity and myths get replaced with facts that work in real life.
If you value clear explanations, honest insights, and content that helps you make smarter decisions for your body, subscribe to the channel and stay with us for more videos like this. Belly fat is often treated as one single problem, but the body stores fat in very different ways. The soft layer that sits just under the skin is only one type, and it behaves very differently from the fat that hides deeper inside the abdomen. Visceral fat is stored beneath the abdominal muscles, where it surrounds organs such as the liver, pancreas, and intestines. Because it sits out of sight, many people carry high levels of this fat without realizing it, even when their weight appears normal from the outside. What makes visceral fat especially dangerous is how active it is inside the body. This fat is not passive storage. It constantly releases fatty acids and chemical signals directly into the bloodstream. These signals interfere with how the body controls blood sugar, blood pressure, and inflammation. Over time, this disruption increases the risk of type 2 diabetes, cardiovascular disease, and metabolic disorders. Visceral fat also places physical pressure on organs, affecting how they function and how efficiently they process nutrients. Hormones are another major area affected by visceral fat. This deep fat alters the balance of insulin, cortisol, and other regulatory hormones. Elevated insulin levels make it harder for the body to access stored fat for energy, while higher cortisol encourages even more fat storage in the abdominal area. This creates a cycle where visceral fat feeds the very conditions that allow it to grow. The result is fatigue, cravings, slower metabolism, and stubborn weight around the midsection. Unlike surface fat, visceral fat responds strongly to changes in insulin levels. When insulin remains high, this fat stays protected. When insulin drops, visceral fat becomes unstable and begins to break down. This sensitivity is why fasting plays such a powerful role. During fasting, insulin levels fall for extended periods, creating an internal environment where visceral fat can no longer remain locked away. The body begins to pull energy from these deep stores first, because they are metabolically active and easier to mobilize under the right conditions. Another reason visceral fat responds well to fasting is its connection to the liver. The visceral fat drains directly into the portal veins, sending fat and signals straight to the liver. When fasting reduces incoming glucose, the liver shifts toward burning fat for fuel. The shift increases the demand for fatty acids, and visceral fat becomes a primary source. As this process continues, the size and activity of visceral fat deposits begin to shrink, improving metabolic health long before visible changes appear on the surface of the body. Fasting works for visceral fat because it directly changes the hormonal environment inside the body. When food is consumed regularly, especially carbohydrates, insulin remains elevated. Insulin acts as a storage hormone, signaling the body to hold on to energy rather than release it. As long as insulin stays high, fat cells remain protected and inaccessible. During fasting, insulin levels gradually decline, removing this protective signal and allowing stored fat to become available as fuel. Once insulin drops, the body shifts into a different metabolic state. Instead of relying on incoming glucose, it begins to search for internal energy sources. Visceral fat responds quickly to this shift because it is highly sensitive to hormonal changes. Compared to fat under the skin, visceral fat breaks down more readily when insulin is low. This sensitivity means the body can access these fat stores earlier and more efficiently during a fast. Hormones beyond insulin also play a role. Fasting increases levels of growth hormone, which supports fat breakdown while preserving muscle tissue. At the same time, adrenaline rises slightly, increasing the release of fatty acids into the bloodstream. These changes work together to create an environment where fat is actively mobilized. Visceral fat, due to its location and metabolic activity, becomes a primary target during this process. The liver plays a central role in this transition. As fasting continues, the liver reduces glucose production and increases fat oxidation to meet energy demands. It draws fatty acids from nearby visceral fat stores. This direct connection allows visceral fat to be used efficiently during periods without food. The longer insulin remains low, the longer this fat-burning process continues. However, the effectiveness of fasting depends heavily on timing rather than sheer effort. Short fasting periods may lower insulin briefly, but levels can rise again before significant fat breakdown begins. Extended fasting windows give the body enough time to fully transition into fat-burning mode. This is why consistent fasting durations matter more than occasional long fasts or extreme calorie restriction. Visceral fat also responds differently based on how often insulin spikes throughout the day. Frequent eating interrupts the fat-burning process, even when overall calories are low. Fasting creates uninterrupted periods of low insulin, allowing hormonal signals to remain stable. Over time, these repeated windows teach the body to rely more on fat for energy, gradually reducing visceral fat stores and improving metabolic flexibility without excessive strain on the system. The fat-burning process during a fast follows a predictable internal timeline that unfolds in stages. In the first several hours after eating, the body relies almost entirely on glucose for energy. This glucose comes from recent meals and from glycogen stored in the liver and muscles. During the 0 to 12-hour window, insulin remains present in the bloodstream, signaling that fuel is available. At this stage, the body focuses on using stored sugar, and fat loss remains minimal because fat stores stay largely protected. As the fast moves beyond 12 hours, the internal environment begins to change. Glycogen stores become depleted and insulin levels start to fall more noticeably. Between 12 and 16 hours, this drop in insulin removes a major barrier to fat use. The body starts releasing fatty acids from storage to supplement energy needs. This shift marks the beginning of meaningful fat burning, although the process is still gradual and depends on how consistently insulin stays low. Between 16 and 18 hours, a more pronounced metabolic shift takes place. The body increasingly turns toward fat as its primary fuel source. Enzymes involved in fat breakdown become more active, and the release of fatty acids increases. Visceral fat, due to its hormonal sensitivity and location near the liver, becomes easier to access during this phase. The liver converts more fatty acids into usable energy, signaling a deeper transition into fat-based metabolism. As fasting extends into the 18 to 24-hour range, fat burning intensifies further, growth hormone levels rise significantly, supporting fat breakdown while helping preserve lean tissue. This hormonal change enhances the release of stored fat into circulation. Visceral fat responds strongly during this window because it is metabolically active and closely linked to liver function. The body draws from these deep fat stores to meet energy demands, leading to more efficient visceral fat breakdown. Throughout this timeline, the length of uninterrupted fasting plays a crucial role. Each stage builds on the previous one, with hormonal signals becoming more favorable for fat use as time passes. Shorter fasts may initiate the process, but longer windows allow these internal mechanisms to fully engage. The progression from sugar burning to fat burning reflects how the body adapts to the absence of food, gradually shifting priorities to maintain energy balance while tapping into stored reserves. The minimum number of fasting hours needed to burn visceral fat is often misunderstood. Short fasting periods that last less than 12 hours rarely create enough hormonal change to unlock deep fat stores. During these shorter windows, insulin may dip slightly, but it often rises again before the body fully shifts away from sugar burning. As a result, visceral fat remains largely untouched, even when fasting feels challenging or uncomfortable. The real transition begins when fasting extends beyond this early phase. Around 14 hours, insulin levels stay low for a longer, uninterrupted period. This is where the internal environment begins to favor fat use rather than storage. The body has already used most of its readily available glucose, and energy demand starts pulling from internal reserves. Visceral fat, which is highly sensitive to insulin changes, becomes increasingly available during this time. This shift marks the entry point where fasting moves from maintenance to measurable progress. Between 14 and 16 hours, metabolic signals align more consistently. Fat-releasing hormones become more active, and the liver increases its reliance on fatty acids for energy production. This window allows the body to repeat the fat-burning process day after day without excessive stress. Over time, these repeated cycles lead to gradual reductions in visceral fat, even when overall weight changes remain subtle at first. Consistency plays a stronger role than intensity in this process. Fasting for 16 hours once in a while produces limited effects compared to maintaining a steady routine. The body adapts to patterns, and regular fasting trains metabolic pathways to access fat more efficiently. Repeated exposure to low insulin periods improves metabolic flexibility, allowing visceral fat to be mobilized with less resistance. Extreme fasting approaches often disrupt this balance. Very long fasts can increase stress hormones, interfere with sleep, and lead to overeating later. These responses counteract fat loss by raising insulin and cortisol levels afterward. Moderate fasting durations that are practiced consistently allow the body to remain calm and efficient, keeping hormonal signals aligned with fat breakdown rather than fat storage. The key factor is sustainability. A fasting window that can be maintained daily or most days creates cumulative effects over weeks and months. Each consistent fast reinforces the hormonal environment needed to reduce visceral fat. Rather than pushing limits, steady repetition builds progress quietly, allowing the body to gradually release deep fat stores while preserving energy, muscle, and overall metabolic health. For most people, the fasting range that delivers the strongest results for visceral fat sits between 16 and 18 hours. This window allows enough time for insulin levels to remain low, long enough to support sustained fat burning without placing excessive strain on the body. By this point in the fast, the body has largely shifted away from relying on stored sugar and has begun to depend more heavily on fat for energy. Visceral fat, due to its sensitivity to hormonal changes, responds efficiently during this period. This range also supports consistency, which plays a major role in long-term fat loss. A fasting window that can be repeated regularly creates predictable hormonal patterns. Insulin remains suppressed for extended periods. growth hormone stays elevated, and fat-releasing signals remain active. These repeated signals teach the body to access visceral fat more easily over time. The balance between effectiveness and practicality makes this range sustainable for daily life, work schedules, and sleep patterns. Longer fasting periods may appear more powerful, but they do not always produce better outcomes. As fasting extends beyond 18 hours, stress hormones such as cortisol may begin to rise. Elevated cortisol can interfere with fat burning by encouraging the body to conserve energy and protect fat stores, especially around the abdomen. This response is more likely when fasting is paired with poor sleep, intense exercise, or high psychological stress. The body responds best when it feels safe and supported. Moderate fasting windows allow metabolic processes to function smoothly without triggering defensive reactions. When stress remains low, fat-releasing hormones can do their job efficiently. This environment favors the breakdown of visceral fat rather than the preservation of it. Excessive fasting, on the other hand, may disrupt appetite regulation and increase cravings, leading to larger insulin spikes once eating resumes. Another advantage of the 16 to 18-hour range is its adaptability. It can be adjusted around social events, work demands, and training schedules without completely disrupting metabolic rhythm. This flexibility reduces mental strain and supports adherence over time. When fasting becomes a stable part of routine, rather than a constant challenge, the body maintains favorable hormonal conditions more consistently. Stress management plays a quiet but critical role in this process. Even within an optimal fasting window, high stress can blunt fat loss signals. Adequate sleep, calm routines, and balanced nutrition during eating periods help keep cortisol levels in check. When stress remains controlled, the body remains responsive to fasting signals, allowing visceral fat to be broken down steadily without resistance. Many people follow a fasting routine with discipline, yet see little to no change in visceral fat. One of the most common reasons lies in what happens after the fast ends. When large amounts of food are consumed in a short period, especially calorie-dense meals, insulin levels rise sharply. This sudden spike signals the body to store energy again, reversing many of the hormonal benefits created during fasting. Visceral fat responds quickly to these signals, making progress difficult even when fasting hours are consistent. Food quality plays an equally important role. Meals high in sugar or heavily processed ingredients disrupt blood sugar balance and trigger repeated insulin surges. These foods digest quickly and push glucose into the bloodstream at a rapid pace. The body reacts by releasing more insulin, which encourages fat storage and blocks access to stored fat. Even with long fasting windows, frequent consumption of these foods can keep visceral fat protected and resistant to breakdown. Sleep quality is another overlooked factor. Poor sleep alters the balance of hunger and stress hormones, increasing appetite while reducing insulin sensitivity. When sleep is limited or inconsistent, the body becomes less efficient at managing blood sugar. This inefficiency leads to higher insulin levels throughout the day, even during fasting periods. Visceral fat thrives in this environment as hormonal signals favor storage rather than release. Stress levels quietly shape fat loss outcomes as well. Chronic stress raises cortisol, a hormone that promotes fat storage in the abdominal region. Elevated cortisol also interferes with insulin regulation, creating a hormonal pattern that favors visceral fat accumulation. Even when fasting is done correctly, persistent stress can override fat-burning signals and slow progress significantly. Another issue arises when fasting is paired with excessive restriction or intense physical demands. When the body perceives a constant threat, it adapts by conserving energy. This adaptation includes holding on to visceral fat as a protective reserve. Without proper recovery, nourishment, and rest, fasting becomes a stressor rather than a tool for balance. These factors often overlap, compounding their effects. High stress can disrupt sleep. Poor sleep increases cravings, and cravings lead to poor food choices. Together, they create a cycle that blocks visceral fat loss despite consistent fasting. The body responds to its overall environment, and when signals of instability dominate, fat loss mechanisms remain suppressed even during extended periods without food. Many people approach fasting with the expectation that it works on its own, as though skipping meals automatically guarantees visceral fat loss. This mindset often leads to frustration because fasting by itself is only a tool that influences the body's internal signals. Its effectiveness depends on how those signals behave over time. Visceral fat responds to repeated hormonal patterns, not isolated actions. When fasting is treated as a shortcut rather than part of a broader rhythm, results tend to stall. The most important signal involved in visceral fat loss is insulin. When insulin remains low, frequently, the body gains repeated access to stored fat. Fasting creates this condition, but only when it is done regularly enough for the body to adapt. Occasional long fasts may lower insulin temporarily, yet the body quickly returns to storage mode once normal eating resumes. Consistency allows insulin patterns to stabilize, creating an environment where visceral fat becomes easier to mobilize day after day. Diet during eating periods quietly determines whether fasting works or fails. Meals that support stable blood sugar allow insulin to rise gently rather than spike. This keeps the hormonal contrast between fasting and eating clear. When food choices repeatedly trigger sharp insulin increases, the body spends more time in storage mode even if fasting windows are long. Visceral fat responds to the overall pattern rather than isolated fasting hours. Small daily habits often have a stronger impact than extreme fasting strategies. Regular meal timing, balanced nutrition, and adequate recovery reinforce the signals created by fasting. These habits reduce metabolic stress and allow fat-burning hormones to function smoothly. When the body feels supported, it releases fat more willingly. Long fasts performed inconsistently can create stress responses that interfere with this process. Another overlooked factor is how the body learns through repetition. When fasting is practiced consistently, the body becomes more efficient at switching between fuel sources. This metabolic flexibility allows visceral fat to be accessed earlier and with less resistance. Over time, the body requires fewer extreme measures to maintain this shift. The process becomes smoother and more predictable. Fasting works best when it blends into daily life rather than disrupts it. When routines remain stable, hormonal signals remain clear, insulin stays low often enough, fat-releasing hormones remain active, and visceral fat gradually loses its protected status. This steady environment allows progress to unfold without relying on intensity or extremes, driven instead by repeated supportive behaviors that guide the body toward fat loss. You do not need extreme fasting to burn visceral fat. Pushing the body too hard often creates stress instead of results. For most people, a 16-hour fasting window is enough to trigger the hormonal changes that allow deep fat to break down. When this window is followed regularly, the body learns to access visceral fat more efficiently without resistance. Consistency matters more than intensity. A fasting routine that fits into daily life produces stronger results than long fasts done occasionally. Pairing fasting with smart food choices keeps insulin stable and prevents fat storage signals from returning too quickly. Quality sleep supports hormone balance, allowing fat-burning processes to continue even outside the fasting window. Together, these simple actions create an internal environment where visceral fat can no longer stay protected. This is how visceral fat really burns. Through steady habits, balanced fasting, supportive nutrition, and proper rest, not extremes or shortcuts. If this video helped you understand fasting more clearly, support the channel by liking the video, subscribe to our channel for more science-based insights that cut through confusion and help you make better choices for your health.